1 in 5 workers could be off work. Your document says in worst case scenario, the police might have to be redeployed just to deal with serious crime and maintain public order. Will you draft in the army if necessary? And can you promise citizens that in the midst of all this, you can keep them safe? Thank you.
Yes, thanks very much, Beth. And let me deal with both those important points. On the NHS and the potential pressure on the NHS, I think that we have a fantastic health service, and it's well capable of handling the most tremendous pressures, as everybody knows. I think one thing it will be important for us all to do, if the virus moves into the kind of stages that our scientific advisors have just been talking about, it will be very important for everybody to think not only what we can do to prevent the spread of the virus individually, but also what we can do to avoid too much pressure on the NHS. So when it comes to using services such as GPs or 111, and it will be quite important to be self-restraining where possible, because as I say, most people will unquestionably get through it. And on your second point about the police and the army and back, there are long-established plans by which the police will, obviously they will keep the public safe, but they will prioritise those things that they have to do, and the army is of course always ready to backfill as and when, but that is under the reasonable worst case scenario. I'm very glad to be joined this morning by the government's Chief Medical Officer and Chief Scientific Advisor. Today we've published the Coronavirus Action Plan, setting out how all 4 parts of the UK will take all necessary and reasonable steps to prepare for and tackle this outbreak. And the plan has 4 strands: containing the virus, delaying its spread, researching its origins and cure, and finally, mitigating the impact should the virus become more widespread. That is, contain, delay, research, mitigate. And let me be absolutely clear that for the overwhelming majority of people who contract the virus, this will be a mild disease from which they will speedily and fully recover, as we've already seen. But I fully understand public concern, your concern about the global spread of the virus, and it is highly likely that we will see a growing number of UK cases. And that's why keeping the country safe is the government's overriding priority. And our plan means we're committed to doing everything possible, based on the advice of our world-leading scientific experts, to prepare for all eventualities. And let's not forget, we already have a fantastic NHS, fantastic testing systems, and fantastic surveillance of the spread of the disease. We will make sure the NHS gets all the support it needs to continue their brilliant response to the virus so far. The plan does not set out what the government will do. It sets out the steps that we could take at the right time and on the basis of the scientific advice. Our country remains extremely well prepared, as it has been since the outbreak began in Wuhan several months ago. Finally, crucially, we must not forget what we can all do to fight this virus, which is to wash our hands. You knew I was going to say this, but wash our hands with soap and water. And forgive me for repeating this, but there will be people first tuning into this for the first time. Wash your hands with soap and hot water for the length of time it takes to sing Happy Birthday twice. It's simple advice, but it's the single most important thing we can do, as I think our experts would attest. But at this stage, and with the exception of all the points that I have just mentioned, I want to stress that for the vast majority of the people of this country, we should be going about our business as usual.